Good morning, everyone, and thank you for joining us today. I'm Dr. Velasquez, Health Officer for Spokane County, and today I'm joined by Alicia Kreitzer, who is a Program Manager for our Nurse Family Partnership. I have to read it because I always say it backwards, which is one of our community-facing programs that you have heard about before. But today we're here not to talk about the program per se, but to focus on one of the areas where they provide a lot of services, which is the area of postpartum depression. Mm-hmm. And I know whenever we say this, well, I better get the blues, whatever, because having babies is difficult. I don't disagree with that, but there's a big difference between the baby blues and postpartum depression, which is what we want to talk about today. So thank you for coming with us today. And let's dive into, so what does your team do when we have someone with postpartum depression? Tell us a little bit about how does that present itself.
I like to actually start a little bit before that. So one of the things that makes our program so helpful is that we start in pregnancy. And that is important because it allows us time to build trust and rapport and a relationship with the client before they enter the postpartum phase. And with that, that creates that safe space to then bring up those sensitive topics, the things that can be scary to bring up if you're not comfortable with the person sitting in front of you.
Okay. Good point.
And then with that, in pregnancy and throughout the program, but twice in pregnancy, we actually do mental health screenings.
Okay.
So we screen for anxiety and depression, and then also loneliness and social isolation, because that we know can affect mental health. And that helps us know what's the client's baseline before babies are born going into the postpartum period. And it also allows us to provide that anticipatory guidance to the mom. For example, if she has a history going into pregnancy of anxiety and depression, that she is going to be potentially at a higher risk for developing postpartum perinatal mood disorder. So that allows us the extra education and support and coaching before the babies are born. And then in pregnancy or in the postpartum period, we really support the parents and the family and the mom in creating a postpartum wellness plan. And this is for any parent because, as you said, the journey into parenthood is such a big transition. And then we want to be especially aware of anybody that has a postpartum mood disorder. So how are they prioritizing sleep? How are they getting chunks, hopefully 4+ hours of uninterrupted sleep? We know those babies, especially right out, eat a lot, but can the partner support in getting mom ready for feeding? Can the partner change the diaper before and after, those kinds of things? So we help mom think through what is sleep going to look like. We help her think through nutrition. Nutrition is so important to all of our postpartum moms as far as the healing process. And then when we're not getting as much sleep, we need extra nutrition. So we really help them say, what's it going to look like to eat small, frequent meals throughout the day? You know, you don't have a lot of time. We don't want to have to prep big meals. But how can you fill those meals with good protein and complex carbohydrates and good fats to really help mom feel better? And then we also help them think about the things that they would do, hopefully in pregnancy or before that, of gentle movement. Can they incorporate some stretching, some yoga, some walks outside? I think something, especially in the winter, that we downplay is the importance of fresh air. And so we really talk about, can you get outside for even 5 or 10 minutes a few times a day? It can be such a regulating thing for mom and baby to get outside and get the fresh air, and we see babies calm down too. So if we have fussy babies, it can be so helpful. And then we really look at those self-care practices that help our mental health. So are we finding times to take a shower? Are we finding moments to step away from caring for baby, for ourselves, for whatever that looks like? Reading a book, reading a magazine, scrolling on our phone, the things that we enjoyed before baby, can we still incorporate those? And then lastly, I would say we help the mom recognize who her supports are and how she can advocate for help in that postpartum space. And if she's not able to do that because we're seeing that her mental health is affected, we can say, what about your mom? I haven't heard you talk much about her. Have you been able to speak with her and ask her for help? And then the last thing we do really is provide those referrals for support and help when needed. So if we're recognizing that there's a mood disorder in the postpartum period, we will often discuss, can we call your OBGYN and talk about perhaps we need a therapy referral or medications, or go back to your therapist. So finding those connections. And then in pregnancy and the postpartum period too, trying to wrap them in support. So are they connected with a doula? And we have a great community of doulas here, including many that are becoming covered by Medicaid. So if you're not sure, definitely check out your insurance benefits. It's such a helpful thing going into pregnancy, birth, and then they do actually have postpartum hours that they can offer often. And then we have community resources such as Shades of Motherhood Network. Our Catholic Charities, Kappa, has a Prepares program that has lots of offerings for pregnant women, Indigenous birth justice. I'm probably missing some, but there's just a great community, so that we try to wrap them into that as well.
Well, thank you. And I'm glad you answered or provided that information. This was a trick question for the audience because I wanted to know if they had been paying attention to you before when you had shared some of that. But I'm glad you started at the beginning, which I think is important. It's not just when there are signs and symptoms. You've been, your team has been part of the journey through the pregnancy, so it's a little bit easier to recognize any signs or symptoms that may be of concern. So let's say that we have a mom that does have postpartum depression. What do we do? Where do we go from there?
Yeah, I think it's important to recognize, as you said, the difference between the normal postpartum period and baby blues, and then maybe it's becoming more of a depression or anxiety. So it's important to recognize that there is an adjustment period in the postpartum period where you're having a huge hormonal shift. You're adjusting to parenthood. This can include those mood changes, mood liability. So one minute you might be laughing, the next you might be crying, and you don't even know why. Those are all very common and normal experiences. Where we start to get concerned is if they become more intense for the mom.
Okay.
The symptoms increase.
Okay.
So, after 2 weeks to a month with the normal postpartum baby blues, those tend to kind of come down. That up to a first year postpartum, we can actually see a mood disorder arise from the perinatal mood disorder space. And so if that's happening, and then if they have problems caring for themselves or the baby, it's kind of interfering with their normal daily functioning or interfering with their other adult relationships, that's when we start to say, maybe we need to take a look at this and get some additional support. And so that's when we would, again, try to refer back to your OBGYN, your primary care provider. If you have already been engaged with like a medication provider or a therapist, it's a really good time to get re-engaged with them. And then I think it's important to recognize that if you're not connected there, you can also seek care at either a behavioral health crisis center or go to the ER for support. And then if you ever have concerns about hurting yourself or your child or somebody else, that's definitely a time to get immediate care. You can call 911 if you don't have transportation, but you would want to seek care with the ER right away.
I'm glad you mentioned the continuum because it's not uncommon for people to say, oh, no, I can't talk about this, or I can't deal with this. And the reality of the matter is going through pregnancy and birth is a complicated issue.
Yeah.
It's a life-changing event. Has been compared to running a marathon for 9 months. Which
I believe it.
I read that somewhere, which not uncommonly, there's a lot of things that are going to be different. And babies don't come with a procedure manual, so there's a lot of learning, so a little bit of anxiety, a little bit of concern can be there. But the first and most important thing for all is to acknowledge and recognize that there's something that's a little bit beyond that and seek help.
Exactly.
And I think you pointed out to many of the resources that we have. So let's say that your nurses are not going to be there the whole day.
Correct.
Although they're there for some period of time.
Yeah.
What can the family or friends of that new mom do if they notice or see something? How can they help?
I think the first thing is to kind of go in with a plan. So if you are in a relationship with somebody that is pregnant, you know they're going to soon be postpartum, think of ways that you can provide practical support before baby arrives. So can you freeze a couple meals and take them over in the first or second week after birth? Can you let them know ahead of time, hey, when you're ready for visitors, I would love to come fold your laundry, make you a meal, allow you time to shower, and I can hold baby. So thinking practically can be very helpful. And then again, we talked about how isolating postpartum can be. You're home, you're removed from work and normal activities, school, things like that. So if they're not ready to have visitors, maybe you're just checking in on the phone, sending a text, calling, saying, if you need a few minutes to vent or just check in or have a good laugh, give me a call today or I'm going to reach out to you.
Sure.
So staying in contact. And then providing helpful communication. So I think this is where if you are recognizing a mood disorder in someone you love in the postpartum period, kind of going in with a plan of how can you gently say, you know, I've noticed it's been a little off for you. I'm just wondering what you're experiencing. And using those I statements like, I've noticed, this is what I'm seeing. How is this showing up for you? And then providing the support that they might need. So choices are great. I see that you need help. Would you like me to hold baby so you can shower? Or would you like me to fold laundry? It's just two choices, and then it reduces that thought process on the mom to have to think, I don't know what I need right now. I'm just exhausted.
Right.
So those are some practical ways that you can show up for somebody in the postpartum period.
Yeah, that's interesting because one of the areas that sometimes we wonder is, well, how can I approach that? I'm not sure how to talk about it. And you just gave us some very good examples. And I like the choice A and B.
Mm-hmm. Yeah.
There's not three, there's two.
Yes, exactly.
And you got to pick one.
Exactly.
So that's always good, being a little bit more assertive. Now, I think we've talked a little bit about the family, we've talked a little bit of friends, the community of support of that individual. Why is that relevant? Why is that important for all of us in the community? What is the benefit of these interventions? What is the impact? What should we be thinking about as a community in terms of this is an important aspect of that pregnancy
Yes.
that we need to be aware of?
Yes. Well, I did get a fact that I wanted to highlight. So in Washington in 21 and 2022, overdose and suicide made up 43% of pregnancy and postpartum related deaths, so birth to the first year postpartum. And we know that many of those deaths could have been preventable had there been the right support. So it's of huge public health importance that we are wrapping all of our families in support, but especially our postpartum moms and babies in such a vulnerable space when they're welcoming this new person. The postpartum period is really where we want to see our mamas be able to bond and attach with their
Right.
baby and build that relationship. And we know that if there's postpartum depression or anxiety, that impacts the ability to do that.
Right.
And so as a community, if we can recognize as much as we can do to support this family, that's going to support them from now as their baby grows and as they re-engage in the community. So we know that if they feel wrapped in support by their friends and their family and the community at large, then they're going to give back. So maybe they go to CAPRA Prepares, for example, and then later decide that was such a good experience and I felt so safe in the postpartum period. Now I'd love to volunteer with them and provide that same mentoring back to the community. I think it just lends itself to the healthier families and community when we can see them return to functioning in the postpartum period. That means that they can resume their work activities, their school activities, re-engage in the community as a whole. And so I can't stress enough the importance of, even when we look culturally, a lot of cultures really, mom stays in bed for 40 days and her food and her nourishment and her care is all provided. As much as we can do that, that's going to support our families.
Wonderful. So I know as a community, we talk a lot about providing children, youth, and young adults with opportunities, which I think is important, is very great. We cannot forget earlier.
Yes.
At the beginning, which is part of that continuum. So sometimes we focus a lot on this over here, but I think the importance of the community is these are community members, a new community member. We don't know the impact that new community member may have.
Yes.
A year from now, 10 years from now, 100 years from now. So it is important, I think it behooves all of us to make sure that we include that period of time as a continuum of how can we provide children, youth, and young adults with the best opportunities for a better tomorrow, right?
Exactly. Yep.
So I think you've given us a lot of information, and I hope everybody was paying attention. And I'm sorry to hear that statistics is a little bit, it kind of like floors you a little bit, but it's
It
a
does.
reality.
Yes, it is.
And as we do know what some of the most significant implications could be, I think again it behooves all of us as colleagues, friends, neighbors, family members to be vigilant and attentive.
Yep.
and lend a hand. It's very
Yep.
simple, as you pointed out. Hey, here's some food that I just made, or let me tell you a funny story. So to give you some levity on your day, because being a mom is more than a full-time job.
Yeah,
Don't-
and yeah, I would also add too. I didn't get to speak to this. I forgot earlier, but
Sure.
if you're recognizing that a mom is struggling in the postpartum period, you can also offer help by again noting what you're seeing, and then perhaps saying, would you like me to make a call with you to your provider?
Oh, good point.
Or sometimes they feel overwhelmed or stuck. And so if you can kind of move the action forward to, let's call your provider, or do you want me to go to the appointment with you so that you don't have to manage getting into the office and baby and all of those things. So being supportive that way. And then I think 2 resources that I like to share for the community at large is the Perinatal Support Washington.
Okay.
So they have a warm line that is staffed Monday through Friday, I believe, during daytime hours that moms can reach out to either calling or texting. So passing that information along if you know somebody that might just want to reach out to somebody that they don't know and get some mentoring support. And then we also have a national maternal mental health hotline, and I actually know that number. It's 1-833-TLC-MAMA, and that is staffed 24/7. So if a mom is struggling, or you are the mom that is struggling, that hotline is available to you at any time.
Wonderful. Well, I want to say thank you to Alicia. Thank you to our Nurse Family Partnership Program. I always invert it because I know they do a great job. We get great reviews, and we have heard from lots and lots and lots of families about the wonderful time they've had with their nurse. So if you have any issues, check our website out. Remember those numbers. All of the information will be available not only on the Facebook Live, but there's a lot of our website. If you go to SRHG and go to the Nurse Family Partnership Program site, you'll get all of that. If you're not sure, go there, check it out, make a phone call, send a text, send a chat, an email, whatever it may be. And let's not ignore anything that is of concern. It may be nothing, but it may be something, right?
Yeah.
And we won't know unless we ask. So
Yep.
with that, I'm going to say thank you again to Alicia. Thank you to all for joining us today. And we will see you again next week. Stay safe, stay well. We'll see you next Wednesday. Thank you.